My name's Andy. I live in Doncaster at the moment. I'm from Preston originally. I've got 5 kids, been married for 31 years, got a Springer Spaniel and a grandchild. So life's pretty busy at the moment. I am housekeeper, but in my past life I was a head teacher. 8 years ago I used to run a school in Rotherham. The children were fantastic. The staff were wonderful to work with. There was a lot of work needed to be done, and I went in it at 200 miles an hour. Unbeknown to me, and until I was diagnosed later, I was suffering from an anxiety and depression when I actually got the job. Eventually, things got on top of me. I wasn't sleeping properly. I was getting very tired. I was getting really bad headaches. I was getting very anxious at work. I was meticulously tidy. Any challenge that came in, I dealt with it immediately. There was a load of building work going on. We had our 5th daughter. It was massive. There was just far too much. It was an accident waiting to happen, really. I decided that I couldn't possibly carry on as a head teacher and that I would take a job in a special school because I thought it would be easier. Unfortunately, that didn't work out. I managed 3 days in the special school and I had a complete emotional breakdown. 2 weeks off led to 4 weeks off, led to 3 months, led to 6 months. At the end of the 6-month period, what would normally happen in an educational establishment is that you would then go on to half pay for 6 months. But because it was quite clear that I was too ill to return, they decided to buy me out. So they gave me an upfront payment of 3 months, and that was it. I had no job, massive mortgage, 5 kids. My wife was working part-time and I just wasn't in a position to support the family anymore. I went through an ATOS assessment, which I found extremely humiliating. They were asking me things about how had I got there, did I have a wash in the morning, could I care for myself, could I answer the phone. I remember getting very cross and saying to the guy, look, I used to be earning 50,000 a year. Do you honestly think I'd be here for £90 a week if I was fit to work? I felt that it was my role to support my family and I couldn't see any way of doing that. I couldn't see a way forward. I wasn't well enough to work, and yet I didn't have any income. You don't appreciate how other people around you are being affected by it. And I did a film similar to this for a group called Mental Health First Aid. And for the first time, my wife was interviewed about her feelings, and to hear talk about the difficulty she had was really hard. But then at the end of the conversation, when she was talking about how it had affected her, she also said that it had made us stronger as a couple. I honestly felt that because I had been told that I wasn't well enough to teach, that I would be entitled to some form of benefits to support me. And when that was turned down, I was really, really upset about it. And having to go through that appeal system when you're already not well, I found very difficult. At the time as well, filling in the forms was just an absolute nightmare because your instinct is to be well and to come across as you're okay, and suddenly you're having to turn it into a negative and say how ill you are, and I found that very hard to do. I was in a fortunate position in that I did get my teacher's pension and I do have an income, and that not receiving benefits wasn't the be all and end all for me. But I know that's not the case for many people. A benefit, when they need it, is their only way of getting through the situation. Now, why there are so many hoops to jump through when you need that, I don't know. People should be coaxed through a situation, nurtured through a situation when they're not feeling well. Instead of having to have a battle, they should be there supported.